Hello, military friends and family, and this is From the Front Lines. And today we're going to be talking about advocacy, and we're going to be sharing a number of clips about just how advocacy is actually in action. And myself and so many other advocates and leaders were able to be at a hearing on Wednesday, November 12th. There was an Assembly public hearing on increasing veteran access to mental health services, and it included a plethora of individuals that have just the knowledge to speak on these different topics, from Derek Coy to Benjamin Pomerantz to Marcel Lies, to just so many individuals that's able to just speak on mental health. And one of the biggest things that we want to talk about is how is advocacy being done, and just listen to a few of these individuals.
Dwyer program uses a very locally designed and highly flexible approach. That's very important, that it be very individualized to the community to support the veterans in that community.
By not doing the right thing pales in comparison to the cost of the back end. One thing I like to tell people is we don't just man, train, and equip our service members to go to war. It is our responsibility as a nation to take care of those who come home.
Intervention to strengthen cultural competency training for providers, to support family-inclusive services for those who have served, to increase telemental health infrastructure and points of access.
Treatment courts, understanding that justice-involved veterans have by far the highest rates of suicide of any subpopulation of veterans. Veterans treatment courts are a crucial component at addressing veteran suicide.
Now, as you just heard, many of the topics that are being discussed, are things that are just discussed day to day. And the most important thing is it just doesn't stay in the four walls of your organization or your house. It's actually being discussed with our legislators. Assemblymember Sturton, who's the chair of the Veteran Committee Assembly, he's organizing and orchestrating a lot of these advocacy for our military community, and that's why we want to be present for a lot of these conversations. And many of these conversations, have discussed the Dwyer programs. And as you continue to listen to a lot of these supporters, you're going to hear a commonality, the issues that are happening.
Mental health first aid for veterans. It's sort of the CPR of mental health offered through the National Council for Mental Wellness. And this is a very specialized training that helps to really build awareness, develop skills and tools.
But we also need to do more to assist with treatment earlier and accessible, in my opinion, so that people don't get to the point of being suicidal. Yes.
It's important for you to understand that we are lacking the appropriate amount of mental health caregivers, both locally and nationally. More specifically to long-term care facilities, the Centers for Medicare and Medicaid Services.
It starts with engagement. And when I say in engagement, being able to connect with a veteran, being able to engage a veteran and see how we can help a veteran.
And as you just continue to listen, the hardest thing is how do we address these day to day? And we address them by talking about it. So as you continue to just hear and just see, you're going to understand that, this is a fight that we're going to keep fighting every single day, a battle that, it just won't stop.
Speak off of this. We know that veterans are often reluctant to seek mental health due to stigma, military culture, and concerns about negative career repercussions.
If we testify today, what's going to be done tomorrow? And so much of what the military community is looking at is we hear, we advocate, but what's going to be done tomorrow? We could bring all these facts, but what's going to be done tomorrow to help our community really address these challenges?
U.S. military veterans have higher rates of gambling disorders compared with civilian populations, and their problem gambling scores are generally double those of civilians, especially when it comes to women. The elevated propensity
when veterans report to us high levels of military sexual trauma, and they often felt that they are not heard when they seek care. At times, seeking services can result in re-traumatization, as we heard earlier today with a male gynecologist at the VA. And both
key problem in the community to me is veterans don't self-identify. The count, it's 34.3% nationwide self-identify. It drops to 29.8% in New York State, goes down to 24.1% in New York
Only
City.
a minority of New York City veterans receive care inside the VA system, which means many present first to community hospitals and clinics. If intake staff never ask, have you ever served in the United States Armed Forces, National Guard, or Reserves, the care path can be missed, key factors tied to service.
And to connect with a lot of these organizations, we say jump on our website, which is the Joseph P. Dwyer Peer Support Project, or you can follow us on Facebook. We have an Instagram. We always post these videos on YouTube, and we're going to continue to share these different resources and organizations, but also try to get you connected to these services, because so much of what they do is to make sure that you're supported and you're connected. So once again, reach out, connect, support, share, all that good stuff that really helps everyone know about the services that's available to them. Thank you.